So when we talk about the Meda Kshaya or depletion of the Meda Dhatu, you will see the signs and symptoms of reduced muscle tissue also, and also reduced fat in the body. So excessive reduction in fat and the signs and symptoms of that. Like for example, there is this symptom, or there is this sign explained which is called as spleen enlargement. Okay. Now, spleen enlargement has literally nothing to do with Meda Dhatu or reduction of Meda Dhatu. So there is a relative increase in the size of the spleen. Why? Because the supporting or surrounding fat is reduced. So it appears on palpation, or when you touch it, it appears as if the spleen has enlarged. In real sense, the spleen doesn't increase in size in case of Meda Dhatu. So it is a relative symptom. So you will feel as if the spleen has enlarged because the adjoining fatty tissue has reduced, resulting into a feeling as if, when you're touching the spleen, you feel as if it's enlarged. Apart from that, Medak Shaya, which is, you will see symptoms of Vata aggravation mostly, and depletion of fatty tissue. So mainly loss of fat, loss of muscle, those will be seen. So lubrication will be reduced, energy will be reduced, strength will be reduced. Those will be mainly the kind of signs or symptoms you will see. Now, Asthi Vruddhi, which is increase in the Asthi Dhatu, you will find excess bone growths, extra bones, or extra teeth. Sometimes people have extra teeth, sometimes there are bony growths, there are calcaneous growths. Those kind of things will be seen in case of Asthi Vruddhi. In case of Asthikshaya, which is loss of Asthi tissue, you will find pain in the bones, weakness, extreme debility. You will find dental cavities, falling of teeth, tiredness, osteoporosis, osteomyelitis, which is inflammation of the bones, roughness of the skin, dryness of the skin, looseness in joints, craving meat. Now, when we are actually examining a person, examining a patient, uh, you do see these kind of symptoms which people, categorically, if you ask people that, do you have you noticed any problems with your teeth recently, and people will tell you. A lot of times I have seen it, I have experienced this, that people say, interesting, because I've realized that I am visiting the dentist more frequently than I used to. Okay, so what is the reason why you're visiting? Oh, I'm tending to get cavities more often than I used to get. So what does that mean? That means that the brittleness is increased. The bones have become weak, so the brittleness has increased. So the cavities is increasing. The tendency to breaking of the teeth is increasing. So when you ask questions, you have to ask them in such a way that they will understand it, they will relate to it. And obviously, though there are all these signs and symptoms explained, some signs and symptoms are predominantly seen, which need to be asked every time you are checking with the person for a particular tissue. For example, you should be asking about pain in the bones, because if I ask about debility, do you feel weak? If the person says yes, I am not getting a definitive answer in terms of whether it is related to muscle, whether it is fat, whether it is rasa, whether it is, bones. I am not getting a definitive answer. So rather, I would ask something related to the tissue, which is very specific, which is like, have you noticed that the cavities are increasing, or you're visiting the dentist more often, or the teeth have become brittle? Those kind of questions will give you a better indication in terms of the quality or the strength of the tissues, rather than asking very generic questions from the list. Okay, so you need to understand which questions to ask. Osteoporosis is another question you can ask, like, if there is weakness of the bones, etc. You will see those in form of ridges on the nails also. The nails are, ridged, and they are thin. You can also ask them a question whether the nails, they break easily. Are you able to grow the nails? You can touch and feel the quality of the nails. So all these will be, how you check when when you're checking the person, when you're analyzing the person for, their health issues or their health problems. Now, Majja Vruddhi. Now, Majja Vruddhi is, again, the increase in the dhatu is seen in terms of heaviness in the eyes, heaviness in the body, inflammation of small joints, swelling in the fingers and toes. Now, swelling in the fingers and toes and inflammation of the joints is something which is a very different feature in case of Majja Vruddhi. Now, Majja, or the uh, nervous tissue, though it is called as the nervous tissue or the nerve tissue, Majja is something which is referred to as the bone marrow inside the bones. Okay, so the bone marrow inside the bones is what is Majja. Now, obviously, the brain is inside the bone, also the cranium. That is why it is also considered as the nervous tissue. The spinal cord is inside the bony structure, which is the vertebrae. That is why also it is considered as the Majja. But if you have to consider it in terms of the structure or the form, it is mainly the bone marrow, which is the Majja Dhatu. Now, the Majja Dhatu increase is seen in these signs and symptoms. Reduction is seen in this manner in terms of osteoporosis, weakening of the bones, thinning of the bones, pain in the joints, pain in the bones, blurring of the vision, lack of focus, lack of concentration, brain not functioning properly, fogging of the brain. Sorry. All these will be seen as Majjakshaya. Now, what is the main function of Majja Dhatu? Explained in the textbooks. What is the main function of Majja Dhatu? Anybody?
Hmm, I'm not sure it's right, but I will see that as protection, a strength of the bones. So because it's inside the bone, it's it is a protection. It's the, the solidity. It keeps the
So
bone.
Majja Dhatu, yeah, so correct. So Majja Dhatu, the main function explained in the books is nourishment of the bones, strength of the bones, and thereby the strength of the body. So basically, what Majja Dhatu does is it is the substance, it is the lubrication, it is the unctuousness of the Majja Dhatu that prevents aggravation of Vata in the bones. Bone is a naturally porous structure. Correct? It's a porous structure. So it has got Akash, it has got Vayu, and it has got Prithvi in it. Now, that porosity will increase if the unctuous substance inside or the fatty tissue inside the bone reduces. The porosity will be lesser if the unctuous substance or the fatty tissue is more. So, obviously, the nourishment of the bones is done by the Majja Dhatu. The strength of the bones is also dependent on Majja Dhatu. So nowhere, I mean, honestly, in the textbooks, it is not mentioned that it is responsible for brain function, nervous system function, anywhere. Okay, this is what you can say, an extrapolation of the information that we have. Like if Majja Dhatu is nervous tissue, yes, it will be responsible for those functions also. But and also because you see that when Majja Dhatu is disturbed, you see problems with the brain functions. You see problems with the sense organ functions. But in the textbooks, they have said nourishment of the bones. Why? Because it is inside the bones. And obviously, formation of the next tissue is obviously there, which is the Shukra Dhatu, because the nutrient fluid will be passed on to the Shukra Dhatu, the remaining nutrient fluid, for the Shukra Dhatu to be formed. Yes, Doreen?
So why is not the Majja Dhatu before the Asti? Because Asti needs Majja to be. So in the order of forming the Dhatus, why isn't it Majja first and Asti after that?
Now I'll read something more and then come back to you rather than giving you some short answer or something which I just feel off the head right now. But I will come back with this. Yeah. I mean, it will have to do something with the subtleness of the tissues, etc. But I will come back with a concrete answer rather than answering something. Yeah. So I'll give you the answer in the next lecture. Okay. So uh, the last one is the Shukra Dhatu. So obviously when Shukra increases, the libido increases. It can also lead to seminal calculi, which is stones actually of the semen.
Your screen has frozen.
Okay. Are we all back? I mean,
Yeah, I think you're back. So you froze, but I've lost your screen. I've got Pedro on screen.
Well,
See up in the top right, you can just click on.
if you pin him,
I've still got Pedro.
go on
Uh,
post, and then you can.
I need the slides. Now I've got you and your slide. Dr. Manish, well done. Thank you.
everything okay?
Yep. All
Yeah.
clear.
Yeah, just lost the network here. So yeah, I had to go on a hotspot. Yeah. Okay. So Shukra Dhatu causes increased libido, excess secretion of Shukra or semen. Those are the symptoms. And when we look at the Shukra Dhatu Kshaya, then the signs and symptoms given are difficulty in ejaculation. The quantity of Shukra is less or with blood. It is also painful, like the ejaculation is painful, the intercourse is also painful, burning sensation of the penis, debility, lusterless face, anemia, fatigue, weak digestion, impotence, etc. So when we are looking at Shukra Dhatu, uh, you will find that the textbooks are mainly talking about Shukra Dhatu in form of a male reproductive tissue. Okay. But when we look at the Shukra Dhatu as such, the functions given are basically of reproduction, which are applicable to both the sexes, male as well as female. So when we are talking about Shukra, we are talking about both the male and the female reproductive tissue. But the books, when we read the books, we get a feeling as if they are only talking about the male Shukra Dhatu. The textbooks, when you're reading, you will get a feeling as if it's only talking about male Shukra Dhatu. But in real sense, we are dealing with both male and the female Shukra Dhatu, which is the reproductive tissue. Now, Ayurveda also believes that the Shukra Dhatu is not a tissue which is located only in the reproductive organs. Ayurveda says that the reproductive tissue is present all over the body. The reproductive tissue is present all over the body. And the reason they give is that the reason why we say that the reproductive tissue is all over the body is because they say that the effects of a sexual stimulation is seen all over the body. The heart rate increases, the breathing rate increases, the body temperature increases. All those effects are seen on the body, which are only possible if the Shukra Dhatu was present all over the body. Otherwise, it would have only had a localized effect. And that also brings us to another understanding that yes, that is true, because every cell in the body is undergoing a process of regeneration, which is not possible without the Shukra Dhatu being present. So if we are talking of Shukra Dhatu, yes, the reproductive tissue is present in the reproductive organs, which is your testes and the ovaries, etc. But if you are talking of reproductive tissue, then it is present all over the body. So if the reproductive tissue is present all over the body, it is doing the functions of reproduction, which is regeneration of cells and so on and so forth. This also then, brings us to a very interesting concept that conditions like cancer, etc., which are basically excess growth without the function happening properly. What is cancer? Cancer is excessive growth of cells which are not able to do their physiological functions. So tissue growth, where the tissue is not doing the function that it is supposed to do. That is what is, cancerous growth or malignant growths. So if we have to consider or think about such growths, malignant growths, then we can say that it has to do something with the Shukra Dhatu. Because excess growth or excess growth of cells, excess growth of tissue cannot happen without the Shukra Dhatu being involved. But the resultant outcome of that is not basically as expected, because the cells and tissues which have grown excessively, they are not able to do the functions that they are supposed to do, because of which then they cause obstruction, then they cause pressure on adjoining organs, etc., etc. So if we look at it, then we can think of it in a way that it has to do with the Shukra Dhatu to a certain extent, without which excess growth is not possible. But maybe the Shukra Dhatu is not healthy. The Shukra Dhatu is not healthy. That is why the resultant outcome of that or the product of that regeneration is not healthy. The same thing is said if the sperm and ovum are not of a good quality, the chances of the baby, of the offspring, having some health problems exist. Some problems, health problems might be there with the baby if the sperm and ovum are not healthy. What does Ayurveda say? Ayurveda says sperm represents father in its whole, ovum represents mother in its whole. They are not expressed. The characters are unexpressed in form of the mother and father in sperm and ovum. It exactly talks about the genetic science. What do genes say? Genes are representation of mother and father in form of chromosomes present in the sperm and ovum, unexpressed. Today, when we are talking of the genomic science, and when people go and get genetic testing done, and they come back with results which say that, oh, I have a tendency to have cancer, or I have a propensity of having obesity, or I have a propensity of having diabetes. What is that? That is basically a chance of having that, because you have certain genes which will give you that condition. But the expression of gene will depend on the lifestyle and the nutrition that you live. And that is why after the genetic testing, what do these labs do? They will put you on certain kind of lifestyle and diet whereby the gene expression is stopped. So that's exactly what we are talking about here, that it is the weakness is present in the body. You don't let that express. You do the lifestyle changes, you do dietary changes where you bring in the rasayana, whereby the weakness of the tissues, the weakness of the dhatus is taken care of. So where the science is heading, it is heading exactly in the same direction what we are studying. People get scared. Oh, I have a gene of cancer. Oh, I have a gene of obesity. I have a gene of diabetes. You don't have to be scared, because the gene doesn't mean that you're going to get it tomorrow. Yeah, you're going to get it for sure if you don't, adjust your lifestyle and diet accordingly. But having a gene and expression of gene are two different things. An expression of gene can 100% be controlled by a proper diet and proper lifestyle. Yes.
There is if people they are aware of this weakness, they will overthink about it and they will create themselves the disease. I truly believe that love will heal. So instead of thinking of what it can happen, it's just always thinking of beautiful love about yourself or whatever to decrease any disease and stop cancer.
Yeah, I mean, see, honestly, when we say that you overthink, okay, rather than talking at a very esoteric level, let's look at it from a physiological level. If suppose you end up finding that you have a gene which says that there is a gene for cancer, and you get scared with it, you get scared because of that, you start thinking excessively about it. Obviously, what is happening, you're creating dosha imbalances, you're creating imbalances with your rasa, you're creating imbalances with your mind, and what is that resulting into? That is resulting into a whole cycle of a whole chain of events where you are more prone to being exposed to the causative factors, which will then result into expression of the genes. What is the main cause why a person is, like, when we are talking about the causative factors, why does a person end up getting exposed to the causative factors? It is the mind. Everything goes back to the mind, end of the day. What is it called in Ayurveda? It is called the mistake of intellect. What is the mistake of intellect? Mistake of intellect is basically, even in spite of knowing that this is not beneficial, you consuming it. In spite of knowing this is non-beneficial, you are exposing yourself to it. Why? Because the mind is not strong enough. What is happening with the mind? Every time your sense organs, end of the day, who is perceiving all these sensory impulses? These are the sensory organs. Correct? So the sensory organs are exposed to everything that is there in the world. It is either the touch, either the smell, either the taste, things you hear, or things you see. So every time you are exposed to a sensory stimuli, based on the previous knowledge, previous information, previous experiences, the body already knows it is beneficial, not beneficial. Correct? Based on previous knowledge, maybe you have read somewhere, maybe you have experienced it yourself. Based on that, the body knows that it is beneficial or not beneficial. So the natural process of the mind is first to discriminate. Discriminate between what? Beneficial, non-beneficial. So you recollect what was acquired as knowledge information, you are recollecting all that back. From the recollection, you know this is not beneficial. So the discrimination process of the mind has told you that this is not beneficial to the body because I experienced the adverse effects of consuming it last time. Because I read it in a book. Because my mother, father consumed it and had a problem with this. There can be multiple ways of getting that knowledge or information. But once you have acquired that knowledge and information, every time you are exposed to the similar kind of a stimuli, the mind will function based on previous knowledge, based on memory. All that information will be recalled. Based on that recall, the first step is discriminatory process. Beneficial, not beneficial. Okay, this is not beneficial. Then what happens? Then the next question is choose. Choose what is beneficial or choose what is not beneficial. Obviously, if the mind is weak, is going to say, let me have it today. Maybe, from tomorrow I will go back to having a healthy thing. So weakness of the mind comes into play, mistake of intellect, you make the wrong choices. Wrong is a wrong word. I'll say you make non-beneficial choices. If the mind is strong, you thought about it, you got all the information, discrimination was done, and then you made the beneficial choice. So you went on a beneficial path. If the mind was weak, you went on a non-beneficial path. That is how you get exposed to, causative factors, which are causing damage, which are causing aggravations of the doshas, etc. Everything is there in the textbooks. Eat this, drink this, do this, don't do this. A lot of this knowledge is actually, traditional knowledge passed on from generation to generation. But still, we indulge ourselves into causative factors. Why? Because our mind is not strong enough to make the beneficial choices every time you're exposed to the sensory stimuli. Why? Because of the weakness of the mind. What is the weakness of the mind? The weakness of the mind is covering of the mind when the mind is covered by the rajasic and the tamasic qualities. Rajasic is basically indulgence, the desire. Tamasic is ignorance. When there is clarity, then you think right, then you make the right choices, you make the beneficial choices, you go on the beneficial path. It doesn't end there. You have to make the beneficial choices every day. That's where again the strength of the mind comes in. If the mind is strong, then we have something called as a strong willpower to continue doing things consistently. If the mind is weak, you will do it for 7 days, lose track, go back to doing non-beneficial things. Same is the case with disease formation, same is the case with healing process. Everything will go back to this basic formula. Every time your sense organs are exposed to the sensory stimuli, the discriminatory process, the recall method, choosing, and then acting. And acting on it day in, day out, every day, months, years, lifetime. everything boils down to, and that is why mistake of intellect, which is basically talking about how your mind doesn't function properly and you end up making non-beneficial choices, resulting into exposure to wrong things, non-beneficial things, and then causing problems in your body. That is the root cause of all diseases, mistake of intellect. I mean, you are in the world, you are going to get exposed to everything that is beneficial and non-beneficial. The knowledge is there, information is there. It's all about discrimination and choosing what is beneficial and sticking to that. And this is where basically, again, the difference is the importance of mind in disease formation, importance of mind in the healing process also. Ayurvedic books, when you look at Vagbhata, Charak, Sushrut, all the first chapters will talk about how to live a healthy life. They don't go into diseases immediately. They will say, this is the daily regimen, this is the seasonal regimen, this is the nutrition, this is the food, this is how one should eat, this is the concept of Agni, this is what happens when Ama is there, etc. etc. They will talk about all this. So what is that? That is basically lifestyle management. And what do they say then? But in spite of saying all this, we are all humans, so we are going to make mistakes. What mistakes? Mistake of intellect, which is called as pradnya parad. Pradnya means intellect, aprad means mistake or fault or crime. We are going to do this. If we do this, we are going to end up into having diseases, problems, etc. So now, after telling you what you do to maintain your health, now I will tell you what will happen if you don't maintain your health. So these diseases will happen, and then you treat them with these medicines, treatments, etc. So it's more of a care than cure. It's more preventive than curative. It's more maintenance than corrective. And that is where, the mind becomes extremely critical. Everything will go back to mind. It's always mind over matter. Stronger the mind, healthier you are. Stronger the mind, faster you heal. Stronger the mind, you know, you will continue to be healthier and, live a better, healthy life. So coming back to this, what you said, yes, obviously, every time people understand this, if the mind becomes weak, if the person becomes weak mentally, it's going to only aggravate the problems. People not sticking to the regimens, people not consistently, doing what is beneficial to them. That is constantly happening all the time because the mind is weak. So the role of mind is extremely crucial. And where does the mind, why mind is there? Because the concept of mind is there is one mind in the whole body. And the mind acts like a connector between the sense organ and the brain. The mind will act as a connector between the sense organ and the brain. So every sense organ, when it perceives or when it receives any information, unless it is processed by mind, it will not be accepted by the brain and retained in the brain. And we have one mind, we have 5 sense organs. So you can focus or you can connect your mind to one sense organ at any given point. You cannot be multitasking. multitasking is a flawed concept. You can do multiple things, but your mind is only connected to one sense organ at a time. But because the mind is very fast acting, it connects and disconnects with one sense organ, connects with another sense organ, disconnects, connects again back with the earlier sense organ, disconnects. So this process of connecting, disconnecting happens so fast that it appears as if it's a continuous process where you are also hearing and listening. Sorry, you are also hearing and seeing. It is not. You are either hearing or you are seeing. And that is why when you are focused, you are concentrating on one thing, a lot of times it happens that even when you are reading something, you don't hear somebody calling. Why? Because the mind is so connected with your eyes that you don't hear somebody. What happened? The sound waves did come in the ear because that's a natural thing. When somebody called, the sound waves came, reached your ear. They caused the vibrations also on your eardrum. It did all the physiology that was to be done. Still, you didn't hear your name being called. Why? Because the connection of the mind to take that perception, the sensory stimuli to the brain, as information was not there. The mind was not there in between. And this is where the concept of focus, concentration, one sense organ, mind connection, connection with the brain, the role of mind in acquiring the knowledge, information, sensory stimuli becomes very crucial, very important. Is it clear? Okay. So now we will talk about the malas. The malas are basically, the waste products. The malas feces is purisha. Purisha is the Sanskrit word for the feces. When the feces increase in quantity, it causes pain in the abdomen, gargling sounds in the abdomen, heaviness in the abdomen. When the feces reduce, it causes movement of flatus, that is the air, in all directions. It causes twisting of intestines. So the intestines will get twisted. Pain in the heart and chest, less quantity of stools. Twisting of intestines is a very interesting phenomenon. People who tend to eat less and who don't get the enough bulk to be formed to the stools, they don't pass their bowels every day. They don't pass stools every day. And in those cases, because of the peristaltic movements and because there is no bile being passed out every day, sometimes the intestines can get twisted. And if the intestine get twisted, it can cause lack of oxygen supply to that area of the intestine, resulting into ischemia, which is lack of supply of blood and oxygen, resulting into death of that part of the intestine, which then needs to be operated and cut off. Otherwise, it can be fatal. It can cause severe shock situation resulting into infection of the intestines and death. So a simple thing, not eating properly, not having enough bulk in the bowels can cause this. Very commonly seen with older people, the twisting of intestines, seen very commonly with older people, because one, as you get old, your muscle strength becomes weak. Your muscles become weak. What is the connection of muscles and the intestines? The intestines are basically, the walls of the intestines are also made from muscles. So when your muscles become weak, the intestinal wall also becomes weak. Old people naturally have a tendency of eating less because their appetite is less. And if they're not eating enough fiber in that, then there is no bulk to the stools. which then causes the intestines to collapse and twist. So this is, I mean, I had an incident in my house. My mother-in-law just went through a similar kind of a scenario where she was to be operated, Luckily, we could get rid of uh, the problem without she being operated. So, but exact same scenario. Doesn't eat enough food, doesn't eat fiber, you know, drinks a lot of coffee. So everything that I explained just now happened with her, and we had a scenario where she was literally in an ICU for nearly 3 weeks, and they were wanting to operate, but luckily it kind of reversed and the situation improved. Mutra Vruddhi, that is the urine increase, causes bladder pain, enlargement of bladder, increased quantity and frequent urination. Obviously, that's the increased urine symptoms. Mutra Kshaya, which is lack of or reduction in the quantity of urine, it causes thirst, bladder pain, dryness in mouth, difficulty in urination, and blood with the urine. So these are Mutra Kshaya, which is reduction in the urine symptoms. Sweda Vruddhi, Sweda is sweat. Increase in the sweating causes excessive sweating, body odor, itching, and skin diseases. They have explained boils, but predominantly it will be skin diseases that will happen. In case of Sweda Kshaya, which is reduction in the sweating, it causes falling of body hair, stiffness of body hair, that is dryness of body hair, cracking of the skin because there is no lubrication to the skin, dryness of the skin, and less sweating. So these are the signs and symptoms of reduction in the sweating. Now, the next concept that is important for understanding of Vikruti is Agni. Okay, and I would say this is, like Ayurveda says, 99% of the diseases happen because of Agni. 99% of the diseases will be because of Agni disturbances, Agni weaknesses, Agni problems. So the difference between living and non-living substances is the presence of Agni. When the digestive fire dies, the person dies. Agni provides bala, that is the strength, varna, that is the complexion, utsaha, that is the energy, vitality, pushti, that is the nourishment, and oja, which is the ojas. So Agni is responsible for strength, complexion, energy, which is the mental attribute, nourishment, and ojas. So practically everything depends on the Agni. Now there are three types of Agnis. Vishama, which is irregular Agni, which is a Vata type of Agni. Manda, which is slow acting Agni, that is the Kapha Agni. And Tikshna, that is fast acting Agni, that is the Pitta. Now, the Vishama, Manda, and Tikshna Agni, though they are called as the Vata type, Kapha type, Pitta type, when we study constitutions, it is said that the Vata Agni is irregular, Kapha Agni is slow, Pitta Agni is strong. But these are actually the Agni Vikrutis. These are not normal Agnis. Why? Because irregular Agni cannot be a normal Agni. Slow acting Agni can also not be a normal Agni. And similarly, a strong Agni or a penetrating Agni or a fast acting Agni cannot also be a normal functioning Agni. And that is why when they say that the constitutions are always in danger of having problems, health problems, it is because their Agnis are already in a state which are not in equilibrium. The Vata Agni is irregular, so sometimes hungry, sometimes not hungry, sometimes the digestion is good, sometimes it's not good. The Kapha Agni is slow acting, so it takes longer time for digestion. Pitta Agni is Tikshna, very strong, so digest the food very quickly. So what is going to happen if the Agni is Vishama, irregular? you cannot really understand whether the food is going to get digested or not every time. So it's a uncertain situation what the Agni will result into. Whether the Agni will result into proper nutrient fluid or the Agni will result into Ama. You don't know. Why? Because it is irregular, inconsistent. With the Manda Agni, the Agni is slow. So the moment you do, or you, when the moment you make this person consume, if, or by mistake this person consumes heavy foods, it is going to result into some problems. In these cases of Pitta, where the Agni is Tikshna, very fast acting, very strong, it is problematic because the food will get digested very quickly and the Dhatu digestion will start immediately. So the tendency of Agni digesting the body cells itself is very high. So, though these three types of Agnis have been explained in the constitution as the characteristic of the doshas, they are not really an equilibrium state of Agni. An equilibrium state of Agni or a balanced Agni is that Agni which will digest the food effectively in a particular period of time without being inconsistent, very strong, or very slow. So, if the Agni gets disturbed, the Vikruti or the disease happens. Agni is digestion, food basically. So Agni basically digests the food. When in case of food, it will digest the food. In case of Ama, it will digest the. So the main function of Agni is digestion. In case of food, if you give food to the Agni, it will digest the food when there is no Ama in the body. The same Agni, like we talked about earlier, the Ushna properties are to be used for digesting Ama. When there is Ama presence in the body, you use the same Agni for digesting the Ama. You do not consume food in those cases. Healthy person, no food, Agni will digest the dhatus. So when a healthy person does not eat food, then the Agni will start digesting dhatus, which is dangerous to the body, which will cause depletion of the tissues, which will cause depletion of the strength. You must have seen, or you must have studied, or I would say you go and research something called as autophagy. Hilary, will you make a note, please?
Yes.
Okay. So you will go and research on something called as autophagy, which is self-digestive processes happening in the body. So study those. Come back. We will talk about those more. So stimulation of the Agni has to be done slowly. If you want to stimulate the Agni, giving the food slowly in increasing quantities will increase the Agni gradually. Just like if you have to light up the fire, you put the fuel in it, whether if it's say wood, you don't put a big block of wood or a big, log of wood to stimulate it. You would use small sticks first to stimulate the Agni, then a bigger stick, then a larger log. So gradually, if you feed the Agni, the strength of the Agni increases. And this is a concept that has to be remembered in a lot of cases where the Agni has become weak, particularly which happens when a person is undergoing a curative thing or is getting better from a disease. If a person has had some serious illness or a chronic illness, the Agni is affected. In those cases, to increase the Agni, the food has to be increased gradually. After Panchakarma, the Agni is reduced. The food has to be increased gradually so that the Agni can be stimulated gradually. This is a general principle that has to be followed. If you don't follow this, you will end up causing weakness of the Agni, armor formation, and more problems in the body than the person had before. So, what are the causes of Agni disturbances? Large quantities of food. Obviously, large quantities of food will cause disturbances with the Agni. Food with qualities like heavy, unctuous, cold, dry, and adulterated. These kind of foods will also cause disturbances with the Agni. Fasting. Excessive fasting will also cause disturbance with Agni. Excessive panchakarma will also cause disturbance with Agni. Suppression of natural urges, that will cause disturbance with Agni. Now, these suppression of natural urges are mainly those urges which are related to the digestive system. Like, for example, passing the urine, passing the stools, passing the flatus, burping. These are the natural urges related to the digestive system. If these urges are suppressed, that will mainly cause disturbance with the Annava Srotas, with the digestive system, resulting into weakness of the Agni. Dosha balance and Agni balance are interdependent. If the doshas are in balance, the Agni will be balanced. What does that mean? The closer the doshas in ratio of each other, the more balanced the Agni. The more the difference in the doshas, like Vata is very high and the secondary and the tertiary doshas are low, the Agni balance will also be disturbed in that case. Okay. So people who tend to be closer to the 33.33% constitution will have more balanced Agni than one dosha dominant constitution. That is the meaning of the. Is that clear? Okay. Now, when the pitta by its drava increases, okay, when the pitta because of its liquid property increases, please understand, pitta is what? Pitta is heating, pitta is liquid, pitta is light and flowing. These are the properties of pitta. So when the pitta increases because of the drava or the liquid nature, the liquid in it, that is the Jala Mahabhut in it, causes reduction in the heating and the penetrating properties. And this will cause the Agni to reduce. Did you understand? Pitta has increased, but still the Agni has reduced. Why? Because Pitta increased, just because Pitta increased because of the liquid nature in it, so it became more dilute in nature, reducing the Ushna, that is the heating and the penetrating properties. Though the relative quantity of Pitta was increased, it diluted the Pitta, resulting into reduced Agni and reduced Agni functioning. I had said this earlier that the understanding of attributes is very important, and this is a classic example where I can say Pitta increases but Agni reduces, which is a contradictory statement. But if Pitta increases by the liquid property, by the liquid attribute, it reduces the Ushna and Tikshna properties, reducing the Agni. If the Pitta increases by the Ushna Tikshna property, which is the heating and the penetrating property, the Agni increases. Why? Because that reduces the dryness of, that reduces the liquid property in the Agni, in the Pitta. But please understand, if the Pitta increases extremely because of the Ushna Tikshna properties, it will completely dry up the Pitta, causing a charring effect on the food also, which is also like a ama. It will be so strong that it will completely burn off the food, making it into a charcoal. I'm giving an analogy, but understand what it means. It means that the Agni is so strong that it will completely burn the food. If you put a food, if you're cooking something and if you don't pay attention, what happens? The Agni is so strong that you burn the food. The food becomes bitter, it becomes dry, it becomes unedible, loses all the nourishing qualities, toxic. Same will happen if the pitta increases extremely because of the Ushna Tikshna properties. The Jala Mahabhut will reduce, pitta will become dry, resulting into such a strong Agni that it will actually burn the food that you're eating, resulting into a charring effect of the food, and end of it, no nourishment, toxic effects of the food. So now you are understanding that it is not as simple as, Agni increase, Pitta increase, Agni increase. No. Pitta can increase, but may not necessarily give the effects of proper digestion of the food as expected. Both the cases. Kapha, by its manda property, the slow acting property increases, reduces the Agni, making it slow acting, making the digestive process longer, weaker. If the Vata increases by the Vishama property, which is irregular property, it makes the Agni irregular, resulting into Vishama Agni, which will result into the Agni being inconsistent. Sometimes it will digest the food, sometimes it will not digest. Is that clear? Okay. So we'll stop here and we will talk about the armor concept next time and then we'll continue on that. Is it clear? Okay.